Dr. Jason Saunders, HBOT USA. Next question is, what's the story with this anti-malaria drug, and what does that have to do with coronavirus or COVID-19? So honestly, it's obviously everything about COVID-19 at this point is more or less experimental. I mean, new information comes out, literally every day, if not every hour. And so, but with malaria, the issue here, that's a parasite, it's a protozoa, it's not a virus, but that parasite attacks the structure of hemoglobin, making it difficult for us to carry oxygen. So the pathology of this potentially an organism that's breaking down the structure of hemoglobin, making this a oxygen carrying issue more than a respiratory issue, is ultimately what brought this to the surface. Now, Plaquenil, which is that drug, what it does, it actually might do a couple things. One, it may help to get this virus from hijacking the red blood cells in the first place. It also will help maintain the structure of hemoglobin. That's one of the roles that it plays with malaria, is to help maintain the actual structure of hemoglobin so that it's not damaged and able to continue to deliver oxygen. And a third is that there's some anti-inflammatory effect. So, they use this same drug for lupus in some cases, or rheumatoid arthritis in some cases, because it seems to have a global effect on reducing the inflammation. Another consequence of COVID-19 are these cytokine storms that you may have heard about. In general, cytokines are just natural chemicals that our body makes. It's part of the normal inflammatory process. And in many ways, we need a very strong inflammatory response, especially something like this, which is a new virus that our body has never seen. The initial response to this virus is critical for how our body will basically tolerate the virus over the course of the virus's life cycle. So our initial immune response, which is really like saying our initial inflammatory response to the virus, is critical. It's important. But if we get too much tissue damage, or the virus, part of the way it destroys the hemoglobin, it's releasing iron into our system. If our bodies get too much free-floating iron, that's also very inflammatory. So we have this combination of a new virus creating an immune response, destruction of tissue creating inflammation, and then this potential release of increased free iron into our body, which is also inflammatory. And this creates a whole cascade of inflammation, or in other words, a cytokine storm, which seems to, in some people, be so out of control that the damage from the inflammation is one of the hardest parts for these patients to recover from. And so this drug may also help reduce that cytokine response, because it does help to reduce inflammation in certain cases. Now, again, not that it's all about oxygen, but sometimes it is all about oxygen. There are a lot of studies on oxygen, in particular pressurized oxygen or hyperbaric, to show that also this not only would help these patients oxygenate their blood, but it is also a really powerful tool to use to reduce inflammatory cytokines and increase, or at least balance, the pro-inflammatory and the pro-anti-inflammatory cytokines to get that system back into better balance. So again, this isn't going to be a one tool that solves this whole issue. It's going to be, people, doctors, critically thinking outside the box, and coming up with a multi-therapeutic approach to handling this new virus and helping patients get to the other side of it and have less damage as a result, recover faster, and hopefully build up an immune system that can tolerate, future exposures.